A 62-year-old man with a history of coronary artery disease comes to the emergency department with substernal chest pain for several hours. An ECG shows no abnormalities. Troponin T tests are negative. Patient is admitted to the hospital and treated with intravenous nitroglycerin with an initial resolution of symptoms. After 6 hours of continuous infusion of nitroglycerin, he reports increasing chest pain. The underlying cause of the patient's recurrent symptoms is most likely also occur in treatment with which of the following drugs? Substernal chest pain for several hours. An ECG shows no abnormalities. Troponin is negative, showing there is no MI, right? The patient is admitted to the hospital and treated with intravenous nitroglycerin. Correct. Intravenous nitroglycerin causes vasodilation of the coronary arteries. Now, after 6 hours of continuous infusion of nitroglycerin, he reports increasing chest pain. Why? The underlying cause of this patient's recurrent symptoms is likely to also occur in the treatment of which of the following drugs. So what is phenylephrine? Phenylephrine is alpha-1 agonist. It is a vasoconstrictor, right? Repeated use of phenylephrine can cause downregulation of alpha-1 receptor, which is called tachyphylaxis, that cannot be overcome by increasing drug dose. This is seen in rhinitis medicamentosa, a condition in which excessive use of phenylephrine nasal spray causes rebound nasal congestion. Okay, other substances causing, this is similar to your nitroglycerin. Correct. This is called tolerance. That's why you have to give a gap of 12 to 14 hours between the doses, right, of the nitroglycerin. And also you can skip at the night time. Oh, that there was one more question about that. So phenylephrine, which is used in alpha, which is a vasoconstrictor. So what happens in rhinitis? There is vasodilation of the nasal arteries. There is increase in secretion of the mucus. So vasoconstriction of that causes decrease in secretions, right? So if you keep on using, there is something called tachyphylaxis, which is also similar to your tolerance. Okay, that is also called rhinitis medicamentosa.
Thanks for watching. Please give a thumbs up and subscribe for more.